So this guy came in, short roots everywhere, resorption from orthodontics. Some would argue this guy needs a lateral window because the amount of bone to the sinus is like 2 millimeters. But if you start flapping, and you would need to create a big flap to be able to get the access to do a lateral wall here, you're going to open up the tissue on really thin roots. And we know we lose bone every time we flap. Instead of doing a lateral wall, I've done a staged crestal sinus lift. And the beauty of that is, again, the trauma's less. If something happens to the crestal sinus lift, we can always revert back and do a lateral wall. So again, here I'm showing you I'm using the PRF and then Ossix bone. The only issue here, again, these biomaterials, they do turn over and don't have high radio opacity. So my sinus lifts rarely look super white when I lift, but I know what I'm looking for. You can tell that there's a dome here. But here you can see me again utilizing my drills to get to the sinus floor, then utilizing my platelet-rich fibrin and pushing that in maybe a millimeter or two, then using my Ossix bone, 3.5 millimeter drill, run in reverse at 25 to 50 RPMs, no saline irrigation, adding incremental pieces of Ossix bone, using the osteodensification drills, using them for a sinus lift, and using them for implant placement as well. Then to show up with a 9 millimeter implant completely encased in native bone. So grew it a solid 7 millimeters without ever opening up a flap on this patient.